What is up? What is up, listeners? Thank you so much for tuning in to another episode of Trying to Function with your boy, Coke Smush, aka Ryan. You guys know me. I'm joined with Travis as always. And today we have a very special guest with us today, Nerissa Hetzer.
Hi guys.
Nerissa, why don't you go ahead and give us a little introduction about yourself?
Yeah, sure. Let's see. I'm from Duarte, California, but currently I am in nursing school in the Midwest. So first time ever seeing snow, pretty cool. Studying nursing. I'm in a graduate program. That's a master's degree for nursing study, clinical and education in case I want to go that route. That's a little bit about what I'm studying. Would you like to know what I do or
Yeah. Give us a little brief
Sure.
rundown on, what's going on in your life.
Okay, yeah, definitely. So day to day, what can I say? Student life. I mean, enough said right there. It's intense, it's challenging, it's chaotic at times. I feel, oftentimes unhinged. I would say there are definitely days where I'm like, I don't know if I can do this, but I somehow always manage to push through and see another day of it. I'm surviving and I actually kind of love the torture in a way. I do really like it. I love what I'm learning and I love being in action. I do some rotations at the hospital and I work in a hospital called Aurora. It's a very popular hospital in the Midwest. I don't know if anyone's familiar. So I work in one of those hospitals and I work on the cardiac unit and I love it. I've learned just so much in that short time span of being a student nurse until now. I mean, I've just really gotten the chance to be hands on more than I've ever. I mean, the things that you see as a nurse is just, it can't be unseen. It
Oh, I
really cannot
bet.
be. I mean, you really get to see all aspects and all different sides of people, the good, the bad, the ugly, and it sometimes it gets bad. And people are, when people are sick and they're not feeling good and they're at their worst, I'm not expecting them to be pleasant and how was your day and this and that. So it really is a thankless job, but that's not why you do it. You don't do it for the thank yous and, all that glory or whatever you want to call it. You do it because you're passionate about the research and the education and what has like basically just science in general, like what science has done for the community and what science has done for advancement in terms of technology and medication and just I could go on and on about all that. It's a whole other topic really, but yeah, that's just a little bit of day to day. I spend a lot of time doing research since it's a graduate program. I spend so much time just trying to look up what's relevant in my scope of practice, and I'll pick a demographic and I'll really narrow in on something specific. And like I looked at like polycystic ovary syndrome in the American community. I've looked at like just like really specific topics and um trying kind of narrowing it down and trying to figure out, what are these health disparities? What are these people who don't have, what is it like for people who don't have access to healthcare? Not everybody has that luxury and that privilege. And so it really is seeing the other side of the coin as well.
That is a lot too, and with that field that you're in, it's not just, somebody that hurts themselves physically or, they need some medication because of a psychosis or something. There's so many different aspects to being in the medical field that you'd be researching all day, your whole life if you were to try to
Yes.
learn everything, So I think taking it, niche by niche and just kind of fine tuning what you really want to understand and learn is the best way to go about doing it.
Oh,
That's
yes.
that's really cool. You have any questions, Travis?
No.
Cool, man. I did have some questions for you, Nerissa. We probably won't get into all of them today, but
Yeah, no
we
worries.
can start and we'll see how it goes with the hour, and we'll get the listeners to tune in next week, or whenever we can get you back in on the next episode for part two.
That'd be awesome. Okay, you let me know.
Yeah, yeah, for sure. So the first question is, what is pathophysiology? Because I know you said, you were studying all these different things and you wanted to get into, this certain field, but you said pathophysiology, and this really stood out to me. So I wanted to, like kind of dive into that and find out why it's important for the medical professionals to understand it.
Yeah, it kind of took me a while to kind of grasp the concept of pathophysiology just because it's it's really such a dense subject, and it really just encompasses so much and so many other fields of study that really pathophysiology exists across all fields of healthcare, and pretty much from dentistry to plastic surgery to go your basic healthcare. It's like everyone is dealing with that, is dealing with pathophysiology, excuse me. So yeah, it's just everyone is dealing with, are we going to worry about infection? Are we going to worry about treating that? Are we worrying about a disease state? Are we worried about, you know, microorganisms getting into a sterile field? In dentistry, you have to, there's always that risk because the throat is right there, and bacteria loves to hang out in the tonsils. I know everyone has been sick before and knows that. So that's just one of those things where you have to be careful, and it's very important for everybody that's in healthcare to know about pathophysiology, which really is a combination of two major disciplines. I would say it's a combination of pathology and physiology. Pathology is kind of just more like pathogens. When you think of pathogens and something that is invading, bacteria, viruses, and then physiology is kind of like how something functions. So, like the function of your bladder, the function of your heart, for let's say. So if you mix pathology and the function of, which is physiology, you get basically pathophysiology, right? So that makes sense. And so that medical term makes sense. And it's also knowing really about anatomy and physiology as well, because if you don't know the structure of the heart, let's say, how are you going to know what it does, and how are you going to know the all the electrical signals, and all the output, and blood pressure and the pulse pressure and so many things that how to read an EKG. I mean, I'm no cardiologist by any means, but there's really just so much that could happen. And I'll say that pathophysiology is one of those things that kind of made me want to be a healthier eater, just because I am terrified of heart disease and hypertension, which is high blood pressure, and all those things that lead to, diabetes and heart disease, which is the number one killer in America, by the way. And it's like, I mean, it beats suicide and car crashes and diabetes. It's like literally heart disease is number one in America. I mean, why do you think? I mean, that really poses some questions. It's like, why is that such a struggle for like our Western civilization, like our United States of America? Like, why do you think heart disease is so prevalent? And like, it really boils down to our diet, like what we're putting
Exactly.
into our bodies. And it's like other cultures, like just say Japan, for example. They're one of the cultures that live the longest. They have one of the longest living lifespans, and they have one of the cleanest diets. They eat a lot of soy, a lot of seafood that's healthy, seafoods, lots of healthy fats. They really don't eat fast food. That's not part of their culture. And it's kind of like also access and everything like that. Obviously, it's way cheaper and faster to have a 99-cent burger from McDonald's than to go
Whoa,
prepare like
whoa. Where are you
salad,
getting 90-cent burgers from McDonald's? Let me know
Okay,
about
whatever,
that.
$1.29 or whatever it is on the value menu, you know
Yeah, I
what I'm
totally
saying?
get what you're saying. That is a big
Like,
problem in America is the fast
yeah,
foods, like fast food are chains everywhere, all across the
it's
nation.
terrible,
And
yeah,
it's convenient. You said it. It's convenient. It's fast and
it's
it's convenient.
convenient.
People don't have to go out grocery shopping for a list for food for the week, and deal with all these groceries in the fridge, and I think that contributes to access and part of it being lazy. Because
Yeah,
I can go to the store and I can spend $50 on groceries for the week and cook some meals, and if I were to go eat fast food, that'd probably only last me 3, maybe 4 days if I was just eating myself.
right,
So
right,
I
yeah,
think,
no.
I would love to visit Japan because
Then we'd
it's
all be
it's
spending
amazing
more.
over there, Yeah, right. But I think that's a good contribution to our problem is the fast food chains
Yeah,
for
no,
sure.
really. It's it's insane. And every single time I'm in the hospital on the cardiac unit, I have to provide patient education. That's a huge part of being a healthcare provider is giving education with what we're telling them. We're telling you this because X, Y, and Z. Not just, hey, good luck with your diabetes. Okay, bye. We're kind of here to guide them. This is X, Y, and Z. And it's like we're constantly giving them education on their diet. Like, you need to change your diet. You need to stop smoking. There are just risk factors that are putting you at risk. And most of these patients are already in heart failure and they already have heart disease. So I see a lot of heart disease. That's why I work on the cardiac unit. So that's why I see a lot of heart disease. I'm sure if I worked in another unit, I would see other things, um I do see that a lot, and it just makes you wonder, like what are we putting into our bodies, but then also what's realistic when we're busy, we're working our jobs that aren't paying us as much as we'd hope they would be, and you know we just need to run through that Taco Bell drive through real quick. Like, you know what I'm saying? Like, you don't have that time to cook a full meal. Maybe it's just, and $50 of groceries, like you said, Ryan. Like, how much groceries is that really? Like, what, a
Yeah,
milk,
yeah,
some
yeah.
eggs, some bread?
That
Like,
that's
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 really not a
barely
lot.
making it.
That's
Like
barely
me
anything.
and my family on a month, we go through like $500 to $600 in groceries. And
Right.
that's just food, for a family of
Yeah,
three. So,
exactly.
especially if you're working two jobs, well, how do you have time to cook for yourself? You're waking
Mm-mm.
up really early to go to your first job just to come back in the middle of the day to maybe change your clothes to go to your second one. So you're being
Right.
constantly on the go. And today, like, people live such a fast lifestyle. There's not really any time to just stop and enjoy a good meal anymore.
Huh, a home cooked meal would be nice. But yeah, just to bring it like back to healthcare, a lot of these people's priorities are groceries and rent. They're not worried about, oh, I need to pay for my health insurance. So lots of people don't have access to healthcare and they don't understand that what their diseases are. Like, they might be struggling with diabetes or heart disease or heart failure or something, or they may have had a heart attack and they don't know how to prepare, what their symptoms are before they get to that point. There's definitely signs before you get to the heart attack point, and we can talk about that later. I just want to say that people don't prioritize their health, and that's like really a sad thing that is part and integrated into our culture, is that we put it on the back burner because we have to put our rent and our groceries and our families on the forefront, you know?
Yeah, I definitely get it. I live that lifestyle myself right now. Everything's going toward rent and food and stuff that I need for my family. So if I were to get sick or if I were to need to go to the hospital, I'm doing everything I can to take care of it on my own. Because if I have to go to the hospital, that's a bill that I can't afford to pay. And I've been guilty of, having a $700, $800 hospital bill come after me for, years. And I'm just like, oh, I'm not paying this. Like, I can't afford this. They don't make it accessible for people with, that are living in poverty to just be able to take care of themselves. And diet, taking care of your physical self is such a big part and plays contribution to your mental health as well. Like your diet, things that you eat attribute to your mental state and how you go day to day. If you don't have the right nutrition, you might be struggling throughout the day. You might get cranky. You might have a bad attitude about something and say something to the wrong person. So
Yeah. No,
taking care of yourself is
absolutely.
top priority, 100%.
Oh, 100%. I want to encourage anyone who's listening to, if they haven't already, to look up Maslow's hierarchy of needs. It's he's one of he's was a very famous person in psychology, but essentially it's a pyramid. If you can imagine a pyramid, at the very, 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 very bottom of the pyramid is your basic needs. And basic needs are food, water, shelter. Those are things that everyone needs. Above that, you advance from that. Once your basic needs are met, you're able to have, maybe a job and have security. And above that, maybe maintain relationships. And then at the very, very top of the pyramid, I might be missing a few in between that. Someone can fact check me. Is self actualization, which is like super peace of mind, however you want to interpret self actualization. There is a definition for it. But I'm just saying, like, to get to that point where you're really not worried about anything. And it's really hard to get to that point, because you can't get to the next point of the pyramid until you get to till the one on the bottom is met. And a lot of people can never advance because their basic needs are not being met. Food, water, shelter. And it just makes you think, like, back to that pyramid, how just factual it is, how applicable it is, to society, to how things work. And mental health is incorporated into that pyramid as well. How can you focus on your mental health when you're trying to focus on what you're going to eat?
Exactly. Travis, you have any input, bro? How,
Um,
how do you feel about, diet? Like, what's your diet like? I know you're super busy all the time.
oh, my diet is horrible.
How
I
much fast
usually
food do you consume on a weekly basis?
on a weekly. Well, I mean, but what would you could really consider like fast food? Because I mean, my meals can range anywhere from like McDonald's, Taco
That's
Bell,
fast
Chick
food.
Fil A,
That's fast food.
uh,
Well, Chick-fil-A's little higher tier
Chipotle,
fast food.
Boba. Today I had noodles and
Oh, don't
company.
say boba, dude. Come on, man.
Qdoba,
Both
man.
Oh,
in the group.
Qdoba. Okay.
I don't.
Wait.
I actually don't like boba.
No, I'm not
Uh,
gonna. We're not gonna get into that. I'll kick you from this
anyways,
conversation right now.
no. So the whole like, I have to definitely emphasize the whole mental health situation side of things. Like it's definitely one of the things that I try and help people out with a lot because mental health is one of not the leading uh, cause for what like death or whatever.
Yeah, because that's heart disease.
Um, yeah, but it is definitely pretty far up there, and it's a lot of like one of the biggest things that I try and help other people with is like don't try and bottle up your feelings. If you need somebody to talk to that you know is not going to judge you, like come talk to me. Like I have a, most of the people at my work or in my past jobs, they still talk to me, and they hell, I've had a fucking few phone calls of people crying to me, and I'm just like, what's going on? Talk to me about it. I don't care. I'm
Right.
not gonna judge you. We all need a shoulder to cry on. Like, and especially like the whole stereotypical thing of be a man. Like, I don't, no,
I'm
no,
too
I
macho to
hate
cry on
that.
your shoulder, bro.
Hate, I absolutely hate that saying. And
Fuck
I
no,
don't
I've
care
cried
who
to you,
you
man.
are. And like, everybody has feelings. and everyone needs to be able to express those feelings to somebody, whether it's your significant other, your best friend, whatever, family member, somebody, because bottling those up is not going to benefit you in any way, shape, or form. And that is it'll help. It'll If you keep bottling them up, then that's another cause for depression, and then depression will keep you from eating, which ruins your diet, and
Oh
it
yeah.
yeah.
It's cyclical. That's definitely true.
But I mean, yeah, I mean, I definitely struggle with mental health every now and again, and it sucks. Don't get me wrong. Like, I used to have bad thoughts. I've been able to stray away from those and get myself around better people that actually listen and care about shit that I have to say.
Right.
And
That's important.
hell yeah, and being able to just, I mean, I don't. It doesn't even have to be about my mental health. Just talking about how your day was, or just the small things to start off with is nice. Just being able to talk to somebody about
True. Very
something
true.
is
That's why I always bug Travis, like, how'd your day go, bro? Because I'm here and I don't talk to anybody, man. I'm like, be my friend, talk to me.
nice.
I
So,
feel
So,
that way. I feel
yeah.
that. Yeah,
so,
coming from California all the way to the
oh
Midwest, I don't
man,
know
I
anybody except
bet.
for the people in my program. And I don't see them like all the time, just when I'm at the hospital. And even when I'm on the hospital, it's not like we're sitting around having a beer or something. So it's like we're kind of busy and it's just human interaction is sparse in the Midwest for me. But one more year or less and I'll be done. So that's the goal. Woo, woo, woo. Yeah, I know I had some questions or I had some responses ready for you guys. And one of the things I wanted to talk about was um, the difference between acute and chronic diseases. And I know you guys have heard these terms before, um, chronic, and I wish it could be marijuana, but it is talking about something that is long term and something that by definition has been going on for 3 months or more. So, like, if it's been going on for a while, I guess, then you would say it's chronic. Like, if someone has herpes, that's a chronic issue. It never goes away. Someone has psoriasis or eczema, like, that's chronic usually. It doesn't go away. That's another chronic condition. Um, and then something else that can be chronic that's in mental health are mental health conditions like PTSD can be chronic. It could be suddenly and it could also be chronic. So the opposite of that would be acute, right? So acute just means it happens suddenly. I don't know if anyone watches Grey's Anatomy or if anyone, watches any medical shows or anything like that, but if you've ever heard someone be like, "Oh yeah, it was an acute onset," or "She had acute chest pain," it just means
She had
that
a
it
cute
was
chest.
suddenly. It just, yeah, right? It means her boobs were cute and on point. No, it just means it was sudden. It just means that it was suddenly. And so that's really just the difference. Just that one means right away and the other one means it's been for a while.
So,
That's
from a
pretty much
pathophysiological perspective, that would be like, so, like you said, chronic diseases are long term. So, something
right.
that is sudden and acute, can that turn into a chronic disease?
Oh,
Like,
definitely.
something just happens, maybe, in the middle of your years, maybe you're in your 40s or your 30s or whatever, and something just happens,
Mm,
and then now it's a chronic disease, right?
right.
So when
Yeah.
when you're educating people with all this, that helps them understand too, because if you don't take care of yourself, you're gonna start having these problems with you. You're gonna start getting diseases. You're gonna start, needing needing aid, needing to go to the doctor
Oh,
for
definitely.
medication or something,
I see
so
a lot of young people that, that are like in their late 40s, early 50s that are, that have COPD, emphysema, that, they're smokers, longtime smokers, and now their lungs are so bad
That's my dad.
that now they're forever gonna be like, okay, once the damage has been done, there is no mitosis, there is no cellular division that can save you. Like, that's it. Once it's destroyed, it's done. Your body isn't able to recover from that, and you damage the lung tissue, and you don't get oxygen the same way. That's why I was telling, Ryan, that it's essentially like you did 100 jumping jacks and you're breathing through a straw to get your air. I mean, how out of breath or short of breath would you feel after that? It's really just such an awful feeling, and to be feeling that way for that's just how you have to be. That's your current constant state, you know? And that's hard because that's where people have to have a complete life adjustment. And if you don't change your habits, such as stop smoking, it worsens and worsens and worsens. And then, of course, you run the risk of cancer and other. You can get esophageal cancer in your throat. You can get lung cancer. There's other things you predispose yourself to. Cigarettes are a major risk factor for cardiovascular diseases. Um, if you look up, what causes a heart attack, it's not that a cigarette would cause a heart attack. It's that a cigarette would raise your blood pressure, and raising your blood pressure could potentially cause a heart attack. So, like, a cigarette kind of constricts the vessels in your body, and by that happening, the blood is not able to flow through um as easily, and that makes sense. If something's like a little tiny straw and it's very tight, 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 how is the blood gonna pass through? The
Yeah.
pressure is gonna build up. The pressure is gonna build up, and it raises your blood pressure. By the time it's pushing blood through, if you have plaque or anything in a clot or anything, that travels to your heart, and then boom, heart attack. It's just like cigarettes are directly correlated and linked to cardiovascular events for sure.
I
That's like a
wouldn't even say, sorry to cut you off, but I wouldn't say it's just cigarettes. It's any nicotine products because
yeah,
nicotine is what
yeah.
causes your blood
Mm-hmm.
vessels to
Definitely. Yeah. I should
burst
have
open.
corrected myself and said that. But yeah, you're absolutely correct. It's all of that. It's everything. It's vaping really is not better than cigarettes. It really is horrible for you.
Absolutely not. It's almost worse, especially with all the different kind of chemicals and stuff that they use in them.
Oh yes, definitely.
That brings me to this question that I wanted to ask about inflammation and how inflammation contributes to the development and the progression of various diseases. Because like COPD, people that smoke cigarettes, they're tarnishing their lungs. Does that cause any inflammation to their lungs? Like, does it?
Gosh. Absolutely. You like so hit it on the head with that.
Because that's what
So like
restricts their breathing, right? Is the inflammation?
sort of. So this is essentially sort of what happens. Um, all of the carcinogens and everything that's in, it's a mixture of nicotine and probably, everything, all the other carcinogens that make up tobacco and everything else.
The 4,000
And
other chemicals too.
right, n- and when you inhale that over and over and over and over and over again, over time, so in your lungs, there's these tiny, tiny, tiny little grape-like sacs called alveoli, and they look literally like little grapes, actually. And when you smoke over time, those tiny sacs are supposed to be filled with fluid and are supposed to be they move, and they're very important for cellular respiration. Essentially, when you breathe in oxygen, your oxygen molecules, literally, when your body pulls the molecules from the air from the alveoli in your lungs. That's the direct contact. The contact point is oxygen from the air to the alveoli in your lungs. And it's those grape sacs. And when you damage those grape sacs, how is the oxygen supposed to meet the sacs in your body if you don't really have as many, or if they're damaged, or if you see what I'm going with that? Like,
Right, like it's blocking access.
it's kind of inhibiting act, like
Right.
it's making it so that it's not possible, or so that it's severely less than someone who doesn't smoke, you know what I'm saying? So they have normal alveoli, they have like a normal 94 to 100% oxygen level. Someone who has COPD lives in the high 80s for oxygen saturation levels. Like, they always feel like they are kind of a little short and out of breath. That's why many COPD people are on oxygen, because they need supplemental oxygen.
Yeah, I feel like my dad's right there. I told you earlier, he recently went to the doctors and she told him he's got like 5 years, COPD. And it's a contribution of smoking cigarettes since he was 13 years old and his diet and just not stopping, and I mean, now he knows, he's got a time limit because of his condition and he still cannot stop smoking cigarettes. That's how nasty this habit is, and
Oh,
I'm trying to think like it's almost as bad as genetics, like I picked it up from my dad. Obviously, it wasn't genetics, but my dad was smoking a cigarette, flicked it out, when he was watering the lawn one time, and I picked it up. I was 10 years old when I took my first hit off a cigarette, but I didn't start really smoking till I was 17, and it's been
mhm.
nonstop since, and I'm 33 now. So I mean, I'm definitely feeling it in my lungs. I know I'm not breathing as well, and I know that if I don't stop, I'm gonna be on the same path as my dad. So it's like I really have to pick and choose these battles here, and understanding the conditions better and what attributes to them can help you kind of fight something like this or give you the motivation to stop. Like I don't
Right.
I don't want to go down the path my dad is. Like I have a kid. He's not even 4 yet. Like
Right.
I want to see my kid have a kid, so I really need to start taking better care of myself, and this conversation is definitely going to help, put me on the right track to do some more research and see how I can do that. So that's awesome.
That's great. Yeah, I'm happy to provide education to anyone who is open to wanting to just have a casual conversation, like, I'm not trying to scare anyone into, out of their habits, but in a way it kind of is that
You're
way.
bringing them to reality, though.
Right.
So
Yeah,
many people are stuck behind screens these days that they don't even pay
Mhm.
attention to what's going on to their body. They're
Mhm.
like, "Oh, I feel like this." Then they go on WebMD and then they figure
Mhm.
out like, "Oh, this is what's wrong with me. I need this medication." Then they need
Right.
medication for those side effects. And then you're all messed up.
Right.
So having somebody that's in this field that can help educate you, like take advantage of that. I'm so glad we're friends
It
cuz
really boils down to pathophysiology. When you know what nicotine does to your blood vessels, it makes sense. And so, like, for example, have you ever had a hangover? Of course, right?
no.
Mhm. You have like
I've
the
actually
worst
I
had a
think I
headache.
think I
hangover.
think
You
you've
have the
seen me
worst
hungover a
headache.
couple times.
You have the worst headache, right?
Yeah.
And like,
You don't
your
want to do
natural
anything.
reaction if you're a smoker is to smoke a cigarette or hit your vape.
Yep.
And then after you hit your vape, how do you feel? Do you feel like your
Worse.
headache got worse or better? Usually,
Worse.
how do you
For sure worse.
it's worse
When I'm hitting
because
it,
you
I feel better,
literally
and then I'm like, oh, I probably shouldn't have done that.
no, it like you're tightening those vessels, and you already have a headache, which means the blood is having a hard time passing through, and you feel the throbbing. And then you have the nicotine, which tightens it even more, and it narrows the vessels even further. And then the pressure rises even more, and like you're over here, risking all kinds of stuff with your high blood pressure. I mean, if you have clots, that gets lodged, if you're forming an aneurysm, boom, that could burst. I mean, like so many things from high blood pressure could go. So many things high blood pressure is just so terrible, like, and a lot of it just boils back down to the diet. Like most people's pressure would be treated if they just fix their diet
So
and did.
I got a quick question.
Yeah.
I have a an acute heart murmur.
Okay.
How does that how does that really affect me with like nicotine and drinking and
Okay, so
caffeine?
people don't really get acute heart murmurs. I would say maybe you had one since birth, or like maybe you could suddenly develop one, but even if you did develop it suddenly, it's very unlikely, but then it would be a chronic condition because it wouldn't go away.
So
Some
it how do I explain this? Because I've been seen by a few dozens of doctors
How long you
throughout
been dealing with it?
all of my military crap. I found out actually when I shipped out to boot camp that I had a heart murmur, but only
Okay, yeah.
three out of the
Yeah, so
nine,
this is a chronic
three
disease
of
now.
the 9 or 10 doctors actually heard it, and they said it was very faint.
Okay. Did they stage it?
No,
Okay. How did you, what did they tell you?
uh, they said it was if very minuscule. If I don't know how to really explain it. They just said that it's there, but it's extremely faint. And it's you can only tell if you have like keen ears for it or some shit like that.
Interesting. You know what? I've heard heart murmurs, and they are. I don't know if you've ever played with a stethoscope, but it is so fun to. I mean, not to put your condition on blast or anything, but it's so fun to kind of hear it. I mean, it sounds like a swoosh. You could hear, and really, what you're hearing in the stethoscope when you're listening to a murmur, this may gross some people out. You're actually hearing air passing through an opening because there's so much pressure in your contraction of your heart that when there's an unusual opening, which is what a murmur is, and you're going to hear it audibly with a stethoscope. Like you can't, it's almost hard to miss. But you're saying yours is really faint. That's very interesting because all the ones I've heard have always been super prominent, but now I kind of want to get a stethoscope out and listen to your heart. You could listen to your own and try to see if you could hear it. It sounds like a breath sound, like imagine someone taking a breath in. It just sounds like not like a heartbeat, like a normal heartbeat would. Yeah, exactly. Sounds like that. Instead of a do 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 like a heartbeat, it sounds like a swish, like a breath.
Oh
It's
yeah,
very
you'd definitely be able to
interesting.
tell.
You would definitely be able to tell if you wouldn't sound like you wouldn't have a normal heartbeat.
You think maybe
Um,
they were trying to get money out of you? And they're like, "Oh, you gotta have keen ears to hear this."
yeah, right.
Well, I don't know. I sat in the medical room for like 3 hours as like 10 different doctors came and like listened to it, and I was like, I'm concerned. Like they didn't tell me what was going on at first, so I'm sitting there freaking the fuck out. My heart rate's skyrocketing. Like I don't know what's
Jesus.
going on. It's cold as hell in that room. I'm just chilling in my boxers, and I'm just like, is everything okay? Like what's going on? And then they just started questioning me about like, is my family known for heart disease and stuff like that? And I was like, not that I know
Oh,
of. Like my mother has heart palpitations
uh-huh.
occasionally, but
And you know what? Heart palpitations are actually really, by nature, pretty harmless. They're pretty normal. If anyone's listening and has experienced that, it kind of feels like your heart skipped a beat, or maybe you felt this if you're just chilling. You notice it when you're most relaxing because your heart is kind of slower, right? If you're relaxing, your heart rate is slow. I don't know if you've ever felt it, but it kind of feels like your heart skips a beat and then you feel it come back and it's like heavier than it would have been, or like it just pounds like you notice something skipped. I don't know if you know what I'm talking about. Have you ever experienced that?
Yeah, it's like the first time I
Yeah.
played video games with Travis.
No, so I've experienced it a few times. I mean, I'm not gonna say I'm a fit or healthy person. I smoke. I don't run anymore. Like I used to be really active until my whole knee situation happened. Um, but I mean, as of like right now, my average resting heart rate's like 50 to 65.
That's good. That's good. That's actually a great resting heart rate. Um, but yeah, and you know what? Heart palpitations are really normal. They are like if you ever drink like a cup of coffee in the morning and you might feel it um orthostatically, which means like from when you get up from in a laying position, like bed, like a bed, and then you get up and stand up and then you're like, "Whoa, I feel dizzy and like my heart feels weird." It's just changes in pressure in your blood and your blood pressure and changes in pressure in general. Like your heart responds to that. It's a machine and it's very, very efficient. Um, so whenever you feel a little hiccup, it always knows what to do. And even when you have a heart attack, it's like it still tries its hardest to recover. I mean, it definitely there's definitely signs before having a heart attack. Not like maybe right away, like in the moment, but you usually have high blood pressure, usually you feel short of breath, like usually you're starting to feel a little crappy.
What about
You
like
know?
your right arm? I heard something about like your right arm goes numb or you feel something
Oh
in your
yeah.
right arm.
Yeah,
Why
so
why is it your
so you
right
very
arm?
good. It's the left arm.
Oh,
But
your left
that's
arm.
a good question. So basically the anatomy of the heart has a you've probably heard of the aorta, right? Well, there's two aortas. There's the ascending aorta and there's the descending aorta. And the ascending aorta goes straight to your brain. It gets its own fucking supply straight from the heart. And then the rest, the descending aorta supplies the blood to the rest of your body. So the first to get the blood from your heart is going to be your arm, your left arm. So if your left arm, if you're having blockage in your let's say you're having a blockage in your coronary arteries and you're having a heart attack, your left arm is going to be the first thing to feel it because it's always the first to get blood supply pretty much because it's right there from the descending aorta in your chest. On the left side, it goes straight into your left arm. So people often feel pain radiating down their arm, like because it feels like it's not getting oxygen, is what it feels like. And then pretty soon you start to feel that way almost everywhere as like it's called ischemia actually, and that's just basically when your blood is not supplying oxygen to your body because it can't get to the tissues. There's no circulation happening. That's why people need CPR. The whole point of chest compressions is to push the blood around so that it circulates the tissues to keep them oxygenated, especially the brain. So if that's the purpose of the compressions in CPR, and then giving oxygen is obviously oxygenating the blood, and then the compressions is circulating the blood, giving blood, circulating it. It's just a mixture of that over and over because the person's unconscious and can't do it themselves. Maybe
S-
they had a heart attack and went unconscious, and that happens a lot. People go unconscious because what do you think happens when there's no blood going to your brain? You get confused. You people who like I'm sure you've seen in movies people who have strokes, they kind of start talking weird and they kind of start acting confused, and that's so true. Like, and same with heart attacks. People start like mumbling and not making sense and acting confused because there's an oxygen impairment. It really is about oxygen.
That's crazy. Yeah, my aunt had a stroke years back and actually like lost feeling in half of her body on her whole left side, from her face all
Yeah.
the way down to her arm to her legs. She was like limping, had to go to, like physical therapy and all this stuff, and
Oh
she's
yeah,
still
people have to.
recovering from it, so
Yeah,
that's
big time.
crazy.
Physical therapy post cardiac event is huge. It's huge because your heart is a muscle and you have to train it again to to work efficiently. And you know what's the craziest thing and what sucks the most is there's this saying in medicine. It's called time is brain. I don't know if anyone has heard of it. Time is brain. Basically, the longer you go without oxygen, the more you're killing off your brain cells, the more you're just, your outcomes are slowly less and less and less, right? Time is brain. That makes sense. Get them to the hospital as fast as possible. Time is brain. But, you know, hold on. Can you hear me?
Yeah,
Sorry,
yeah,
my
yeah.
computer.
Yeah,
Okay.
sorry. I wanted to go back to, we were talking about heart palpitations and, we sprung off of Travis's heart murmur.
Oh yeah.
I wanted to ask if you could provide examples of genetic disorders and explain their pathophysiology. So like
Sure.
a heart
Genetic.
murmur and a heart palpitation, like he wouldn't have the heart murmur because his mom had heart palpitations, right? Like that's not a genetic disorder.
Right, right. A heart murmur could be a genetic disorder that, maybe his one of his parents has a heart murmur. Um, but heart palpitations are really not something that, I mean, I suppose you could be genetically just predisposed to it, but it's like imagine having the hiccups, you know? It's kind of like something similar to that. Um, a palpitation really is something called a premature ventricular contraction. And really, it's just, I don't know if anyone's familiar with the heart, but you know how there's chambers, you have the upper chambers and the lower chambers, you have the atria and the ventricles, and they work together synchronously to pump the blood around. And oh wow, I just forgot what I was saying because I totally got distracted by my dog.
No worries. We're talking
Oh,
about, yeah,
the
yeah, you got it.
genetics. Uh-huh. Yeah, and so but just saying that, like, you could be genetically predisposed, but what you're experiencing is a PVC, a premature ventricular contraction. And that just is a mismatch between the ventricle and the atria, like the top and the bottom half of the heart. Sometimes it's an electrical like issue. It's nothing to do with your blood, has nothing to do with oxygen. You have a pacemaker, a natural pacemaker in your heart called a SA node, and it controls the rhythm and rate of your heart. And sometimes like that could be damaged and then that is a whole other problem. But naturally a PVC you can think of as kind of like a hiccup. It's kind of like a heart hiccup. Like it really is not dangerous. It's totally normal. It happens. Um if you ever have had a PVC, um I wouldn't be worried about it. I would not WebMD yourself and freak yourself out. Don't give yourself a panic attack because it a heart palpitation every once in a while is totally normal. But if you start having shortness of breath and, maybe some arm pain, and there's actually a real simple way to check. You should pinch your finger right now. Pinch your finger and then let it go. And you'll see that when you pinch your finger, it turns white. But as soon as you let it go, it immediately turns red, right?
Yeah, that's
Within
crazy.
seconds.
My
Like
my my
within
whole hand too.
probably like what? You would say definitely like less than 2 seconds, right?
Yeah,
Less
yeah,
than
it's
three
less than two
seconds.
seconds. It's almost
Okay.
instantaneously.
That's called a capillary refill. People who are having a true cardiac event, like they're having a heart attack, they'll have a really high capillary refill time. So let's say they pinch their finger and they let it go. Instead of the blood returning to their finger immediately, like yours and ours did, it will take like a really long time to return because guess what? There's no blood supply going around. And any blood supply that is going around is protecting your brain and your heart. They're not worried about your fingers. So, yeah, your fingers are going to stay white. Someone who's having a heart attack, if you pinch their finger will stay white.
That's
So that's kind
crazy.
of like another way. If you're freaked out and you're kind of like, you can always check yourself. And if you have a high cap refill time, then maybe you have poor circulation, but also don't freak yourself out. That'll happen if you're really cold too. If you've ever been really cold and your fingers turn white, if you do the cap refill test, it'll stay white. That's just a normal
Right,
response
because
to
you're
the cold.
cold, so your blood's not flowing as fast as it should.
It's protecting your vital organs
Right.
essentially when it's cold. Yeah, so that's normal when it's cold. But in normal circumstances, it should be less than 3 seconds.
So is there a way to decrease your refill time? Like increase blood flow somehow? Maybe like do jumping jacks. Does that do it?
Yeah, so increasing oxygenation. So if you take a few deep breaths, that will do it, but don't hyperventilate. Hyperventilation is like taking a lot of breaths in and out, in and out, in and out is not the same as taking controlled deep breaths that is more oxygenating than hyperventilating. Hyperventilating is when you don't give your body the chance to convert to carbon dioxide and the blood becomes the pH becomes off and you get dizzy and you pass out essentially because you become really really toxic. Your blood gets toxic from the hyperventilating.
Oh, Travis, you're so
Um
toxic.
toxic.
Earlier you had mentioned homeostasis. Can you explain the concept of homeostasis and its significance in pathophysiology?
Let's see. So do we have 5 minutes? Because I just want to
Yeah,
make
yeah,
sure
yeah,
I
for sure. No, you got time. You got time.
okay. I do have just 5 minutes. Okay, so I'll just squeeze that one in. Um, okay, so homeostasis, like that kind of is a vague term, I would say. Homeostasis could apply to a lot of things, but in terms of the body, I would say that's just being within normal values. You want your body to be at a normal temperature, average is 98.6, but some people are like 97.8. That's me. I kind of run on the cool side. And then sometimes I'm 99, but that doesn't mean I have a fever. Some people are just, running hot or cold, but they're still within a normal range. But really, homeostasis is a constant balance. So, like, when you're cold and you're
Right.
shivering, you're shivering is you're shaking vigorously
To
to warm yourself
restabilize.
up. You're
That makes sense.
literally trying to be in homeostasis at all times in your life. At all times in your life, your body is fighting for homeostasis. When you have a fever, it's fighting for homeostasis. When it's really cold outside, I mean, you name it. There's a million. When you're sick, your body's always trying to get back to normal and fight that infection.
That's why
Lots of,
sweat you sweat so much, right?
yeah,
Because it's like trying to
exactly.
sweat out that infection.
Right.
I sweat so
Right. You
much when I'm
pee it
sick. It's
out.
ugly.
Yeah. No, exactly.
But I'm like
Mhm.
never sick more than, I have the flu, and when the flu puts people out for a couple weeks, I'm down for 4 days. Because I'm in
Oh, wow.
sweatpants and a sweatshirt and I just completely sweat it out. Just rest and, keep up on my fluids. And that's, I
Yeah,
guess,
that's
my way
true.
of, being, having that homeostasis within myself. As my body just regulates it like that. And so I grew up, I'm like, oh yeah, I'm sick. Time to sweat it out.
Yeah, that's so true. My go-to is Gatorade. Honestly, I swear by Gatorade.
Is that real?
Really,
Like the electrolytes and stuff?
oh my God, I cannot stress this enough how important electrolytes are. The electrolytes are not vitamins. Do not get confused between vitamins and electrolytes. Electrolytes pump your heart, control certain functions of your metabolic functions of your body. They signal hormones. They signal hormones that go off in your body that also perform functions within your body. I mean, you need that. You need electrolytes. The most important electrolytes are sodium and potassium. Those are the most important. Um, I mean, so many things could happen when you don't have enough sodium. You could have a seizure. When you don't have enough potassium, you could have a lot of something called dysrhythmias, which is like just a really, really abnormal heart rate that's like fast, and it would be uncomfortable for a long period of time and you would be uncomfortable. Um and yeah, no, it would be out of whack. You want to be like within a range. Like homeostasis isn't about being perfect, it's about being in a range. So like for example, potassium. You want to be within 3.5 and 5 like grams per mole or whatever it's called. And you can be 4, you can be 3.8, you can be 4.8. As long as you're between 3.5 and 5, you're good. As soon as you start getting above 5 or below 3.5, you're getting risky and you're starting to risk your heart. Your heart is the first muscle to respond to low potassium or high potassium. A lot of people who have heart attacks have to take potassium supplements because potassium is always affected when it comes to like most cardiac events. It's super, super important. That's why I really just love Gatorade. It tastes good. It's better than what's the other one that's like watered down. You know what I'm
Powerade.
talking about?
Like the vitamin
Um,
water?
no,
I'll say I like vitamin water, but if it's not vitamins, then you get
oh,
electrolytes.
Pedialyte. I was thinking of
Oh,
Pedialyte.
Well, Pedialyte's like
Yeah.
for kids, isn't it? Like
It's
for
No.
adult Pedialyte, and I always
yeah,
get
dude. Kelly got
whenever I
some. I
start
was like, what is
whenever I feel
this?
sick and shit. I get 4 bottles of Pedialyte and then a box of Dayquil Night.
People always say,
Save
and this
shit.
is, I'm so sorry. Continue. I totally cut you off.
Yeah, you're good.
All right. Oh, I'll go then. So
Sorry, I
Kelly.
had to sneeze.
Oh, you're good. You're good. Kelly got some Pedialyte, right? Or not Pedialyte. I forget what it was called, but it had electrolytes, right? Because she said she needed electrolytes, and I went to drink it, and it's literally like the Pedialyte, but for adults. So like when my kid was, he was like an infant or a little smaller than he is now, and he wanted popsicles, I'd get him like the little Pedialyte popsicles, and I went to eat one, and I was like, this is definitely a Pedialyte popsicle. I could taste the electrolytes.
Oh, that's too funny. Yeah, no, that's too funny. Well, the only thing I want to leave on is like the reason why Gatorade is so much more superior than Pedialyte, in my opinion, is because of the sugar. People always argue that, oh, there's too much sugar in Gatorade, blah, 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 blah. Well, let's just say you're sweating. What are you sweating out? Sugar
Water.
and water. Let's
Yes.
just say you're throwing up because you have a hangover or you're throwing up because you're sick. What do you think you're throwing up besides stomach acid? You're throwing up sugar too. You're throwing up but you're changing your electrolytes, you're changing your pH, you're changing everything. And not only is it important to rehydrate yourself, but glucose, which is what sugar is, it's the most important thing that you could give your body besides literally oxygen. Your body runs on sugar. That's the most, like your brain only, the only sugar that your brain uses is glucose, which is sugar, like pure direct sugar, like from bread, pasta, like, whatever, from Gatorade, is my point. Like, you need the sugar. Like, if you are dehydrated, trust me, you need the sugar too. Unless you're diabetic, I wouldn't worry about the sugar in Gatorade. You know what I'm saying?
Yeah, there's not
Unless you have,
enough to where it's gonna like jack
yeah,
you up
unless
off
you're
sugar.
pounding, yeah, and if you're pounding Gatorade, I get it because there is a lot of sugar if you drink it like a soda, like all the time. But like every once in a while, like it is so fine.
Yeah,
I
use it
will
as a
swear by
replenishment.
Gatorade.
Yeah, I actually speaking of hangovers and Gatorade, that's my go-to hangover cure. I go to McDonald's, I get a medium fry, and I get the blue, well, it's Powerade, but they're pretty much the same thing. I get the blue Powerade and I mix it with Sprite, for the combination. Obviously, Sprite helps, my stomach with the bubbly, and it's not a dark soda, so it doesn't make me feel like shit after. But that sugar, from the Powerade and the Sprite, and then the sodium from the fries, make me feel
Okay.
homeostasis again. Oh, did we lose her?
You kind of cut out for a bit, so I totally missed it, but I caught the end.
Oh, okay, no, I was just mentioning, like Powerade, the blue Powerade and the Sprite from McDonald's, and French fries are my go-to hangover cure. I get my
Oh,
electrolytes from the Powerade and the Sprite. The bubbly helps the stomach, and then the fries with the
oh
sodium.
yeah. Oh yeah, you know what? The Sprite at McDonald's don't play. It's so crisp. Oh, it's amazing.
It's too carbonated for me.
Yeah, but if you mix it with Powerade, it's good, man. It kind of dilutes the carbonation a little bit, but you still get like a carbonated, like lemon lime power. I don't freaking know. It's good.
And it's like Baja Blast.
Which I will not complain about. I love me some Baja Blast. But yeah, Nerissa, we did hit our hour mark. I really appreciate your time. We got through 5 of the 10 questions, so if you're free for another, another episode, we'll go ahead and do it next time you're free. We'll go through the next five
Yeah,
questions.
totally. I'd love to.
Cool, cool. So I'll touch base with you. I want to thank all the listeners that, stuck around and listened to all this educational stuff. Thank you so much. Don't forget to stay tuned next time. We're going to have Nerissa again to go through these other questions and get some more knowledge about this. Thank you so much.